Okay, so we're going to be covering the Flexor Hallucis Brevis to the Illiacus. Okay, so the first muscle is the Flexor Hallucis Brevis. The origin is the cuboid, and the insertion is the hallucis. The second muscle is the adductor hallucis. You can't see this one, but it goes diagonal across the foot. And the origin is the second, third, and fourth metatarsal, and the insertion the lateral side of the hallucis. Third muscle, flexor digiti minimi brevis. Origin, fifth metatarsal, insertion, fifth toe. Next is the extensor digitorum brevis. You can see this under the tendons on the foot. The origin is the calcaneus, and the insertion is the four toes. Moving up to the leg, we have the rectus femoris. The origin is the anterior inferior iliac spine. Insertion is the quadriceps tendon.
Just in case you're wondering, this is the front of your quad, so the front of your thigh.
Yes. Next, we have your sartorius. This goes diagonal across the leg. The origin is the anterior superior iliac spine, and the insertion is the upper medial tibia. Next, we have the vastus medialis. The origin is the linea aspera, and the insertion is the quadriceps tendon.
This is on the same side as your big toe.
Yes. Next, we have the vastus lateralis. The origin is the linea aspera, and the insertion is the quadriceps tendon. Next is the vastus intermedius. The origin is the anterior femur, and the insertion is the quadriceps tendon.
And that was right below your rectus femoris.
Yes.
Also remember that the sartorius is the longest muscle in your body.
Okay. Next, we're going to move to the back of the leg with your semitendinosus. Tendinosus meaning the top muscle. The origin is the ischial tuberosity, and the insertion is the upper medial tibia. Next is the semimembranosus, which is under the semitendinosus. The origin for the membranosus is ischial tuberosity, and the insertion is the upper medial tibia. Next, we have the bicep femoris. That's on the lateral side of the back of the leg. The origin is the ischial tuberosity and linea aspera, and the insertion is the upper fibula. Next, we have the gracilis, the most medial muscle on your body.
So this bone represents your symphysis pubis.
Yeah. The origin will be the pubic bone, and the insertion will be the upper medial tibia. Next, we have the pectineus. The origin is the pubic pectineal line, and the insertion is the pectineal line on your femur. Next, we have the adductor brevis. You can't see this muscle. The origin is the pubic bone, and the insertion is the upper third of the linea aspera. So this muscle is under the gracilis and adductor longus.
Gracilis, adductor longus.
Yep. The adductor longus is next, and the origin is the pubic bone, and the insertion is the middle linea aspera. Next is the adductor magnus. The origin is the pubic bone, and the insertion is the linea aspera adductor tubercle. Next is the psoas major. The origin is the last thoracic lumbar, and the insertion is the lesser trochanter.
If you're looking for it, this is the only leg model that he has it. It's the piece that sticks out on the top. So if you're looking for it on the other models, you're not going to find it.
And last, we have the Illiacus. The origin is the iliac fossa, and the insertion is the lesser trochanter. And that's what we have for you today.